Federal scientists are being deployed to New Brunswick following concerns raised by a medical specialist. He wants more testing into mysterious neurological symptoms seen in some patients. The province did investigate, but then closed its probe. It says despite the help, it's not reopening it. CBC's Kate McKenna explains what these federal scientists will be doing.
They're going to be helping the clinician who has been the one sounding the alarm about what he says are an abnormal number of young patients presenting with severe neurological symptoms, but they're not helping him in the way that he wants. So what we've heard from the government of New Brunswick is that they've asked for help from the federal government to deploy 2 additional epidemiologists to New Brunswick, where they say they're going to help Dr. Alier Marrero, who is the neurologist at the center of this, essentially with his paperwork. They're going to help him kind of categorize the patients that he's been seeing, and they say that that is something he's mandated to do by law. But if I could just pull back for a second here, Dr. Marrero has been writing to public health officials since the beginning of this year, saying he's seeing not just a couple, but more than 150 patients in New Brunswick and in some surrounding provinces that are presenting with severe neurological symptoms, talking about dementia, talking about people who are losing the ability to speak or walk, and that the province should do more investigation. Particularly, he says they should do more investigation of possible environmental factors that could be causing this. He suggested that they look into blue-green algae, which produces a neurotoxin, and that they also look into a neurotoxin that's in, or a herbicide, glyphosate. So those are things that he's asking for, but that's not today what the New Brunswick government is ready to commit to. So a lot of people will probably remember that a couple of years ago, the government of New Brunswick launched an investigation into what was being called a cluster of 48 patients who were presenting with strange neurological symptoms. Now, they closed that investigation more than a year ago, saying that they had reviewed the cases and they found that they all should have been diagnosed with something else and that there was no mysterious brain illness. Now, families and the Dr. Marrero have not been satisfied with that explanation, but the government says it's sticking to it.
CBC's Kate McKenna in Ottawa, and you can read more about this in Kate's online article. You can find it at CBC.ca/news. But for more on this, we're going to be joined now by Sarah Nesbitt. She has been suffering from this mysterious New Brunswick illness since 2020. Sarah, thank you for your time and thanks for joining us. You were very healthy, I understand, before all of this happened. Can you walk us through how things have changed for you?
Sure. So I went off grid in 2020 after a career in radio and heavily involved in the community of Moncton. I went off grid in Steves Mountain in 2020, get in touch with my soul and the nature of things in our beautiful province. And only within a short months, I started losing control of my bowels, my bladder. Also, I got nerves, tingling and numbness. And I had called my doctor and was into him by the fall. So I lasted 2.5 years off grid and I just progressively got worse. I then began having seizures and tremors, not knowing where I was, even though I was at home. So I pushed as long as I could. And then I had to give up my cabin. I could no longer live alone in the woods for safety reasons. I burnt my hand on my wood stove. It was like my hand wasn't getting the signal stop fire. And at that point I thought, it's too much of a risk. So I've had to give up my home and my dream of living off grid, my careers. I work with horses as well, so I can't do much of that. So I've literally, my whole life was basically taken away from me.
Sarah, what have the doctors been telling you? I mean, this sounds very scary.
It is. And at first, because, I'm not somebody that's a, hypochondriac or anything, I thought, I didn't drink enough water, or I pushed myself too hard because I've always worked multiple jobs, worked really hard. So I called an 811 number, the one you call to find out, you ask questions about health. And they said they couldn't continue the call because it sounded neurological and I had to go to the ER. It was a time during COVID, so things were a little bit off, so I didn't go and I just started following my family doctor. And he did a lot of tests and he thought it was MS. So I kind of had prepared myself for that, but he did some testing, couldn't find any MS. So he sent me to Dr. Marrero in Moncton. And ever since I found him, it was neurological. I just wasn't sure what it was until 2022. He had said that I was like others. So I asked him kind of, what is that? And I learned the group, Steve Ellis's group, about the patients, and I got in contact with quite a few of them and found we all had quite similar symptoms. But everywhere I turned, they were telling me it was neurological.
So this was investigated, this cluster of cases, some 48 cases, was investigated, and the province, closed that investigation. And what was your reaction when that happened? They determined that everybody should have been diagnosed with something different.
Right. So the original 48, I was not a part of the original 48. So right after New Brunswick had said there was no such thing, and they said that they did their investigation, ruled out environmental causes without testing for environmental causes. At the time, because I was off grid, I wasn't paying attention. So I didn't even know that it happened. So once I got involved, it kind of was already deemed as that. But my concern is that there's so many people suffering. If they do believe it's other things, I'm not sure why they're not treating them. But I've been ruled out Alzheimer's, dementia, MS, cancer. I've had so many tests in the last few years, probably combined, it's more than my entire life. So, yeah.
That's got to be so frustrating for you. What's your hope now that you know that these federal epidemiologists are coming to New Brunswick, at least to help with the paperwork here? What do you hope comes from that?
Well, first of all, it's great that Dr. Marrero is going to have some help, because throughout the years, he's continued to discuss that there's more case and in the paperwork, and he really does care. So I hope the support for Dr. Marrero is an unbiased support, and that they also do look into environmental testing, because I host support groups for the patients, and there's a lot of things that are quite similar that we would hope that the government and public health would look into.